Hi, my name is Meghan Bright. I'm a physical therapist here at Knob Noster Physical Therapy, and today I'm going to talk to you guys about carpal tunnel syndrome. We'll talk a little bit about what the signs and symptoms are, what some risk factors are, and then some tests you can trial to see if this is potentially something you're dealing with. So carpal tunnel syndrome is irritation to the median nerve here at the wrist. So we basically have 8 bones at the bottom of the wrist are carpal bones. And then in between there, we have 9 tendons that kind of move the fingers such like this and the wrist forward. And then we have our median nerve. And then on top sits our flexor retinaculum. So when we get swelling or irritation under there, it can result in numbness and tingling in the palmar side of our first 3 digits and then half of our ring finger there. The median nerve does run up the arm and into the neck. So it can also get irritated at the base of the neck. So there's some tests that we do in the clinic to differentiate that. The other thing we commonly have patients come in with is numbness and tingling in the 4th and 5th digit, thinking that this is potentially the carpal tunnel, but that's actually another nerve that's getting irritated. So carpal tunnel specifically, what you're going to see is some loss of strength in the thumb or even in our grip because our median nerve innervates those small little muscles in our thumb. Another common sign you'll see is that individuals will wake up in the middle of the night with their symptoms, and this is secondary to at night we often fall into like our wrist being in a prolonged flex position or extended position. These are both positions that can irritate that median nerve and cause that numbness and tingling in that distribution. In severe cases, we will see muscle wasting or atrophy in this thenar eminence here, this bulk of muscle under here, and that's the muscles that move the thumb. The other thing we'll see is persisting sensory symptoms, so prolonged symptoms in that distribution that we talked about. Some risk factors that make you a little more susceptible to this will be any sort of occupation that involves like a vibration tool, any sort of occupation where your wrists are going to be in that flexed or extended position for a prolonged period of time. Any sort of inflammatory condition can lead to increased swelling under there. Any sort of condition that is going to retain fluid. So it's more common in pregnancy or in individuals dealing with hypothyroidism. And so some basic tests that you can try at home to see if this is what you're dealing with. So the first one, we call it the Phalanx test. So essentially what you're going to do is you're going to take your wrists, you're going to place the back of them together. You're going to hold that for 30 seconds. In that 30-second time domain, you're going to see if it reproduces any numbness or tingling in those first 3 digits and then half of that ring finger there. The second test is called the reverse phalanx. So you just do the opposite. You're going to go in that prayer position, and then you're looking for those same symptoms into the hand. Another test that we commonly use, and it's mostly based on individuals telling us, is anytime they're experiencing the symptoms, that flicking their wrist like such causes the symptoms to go away. And that's a very positive sign that you're probably dealing with carpal tunnel syndrome. So I hope you guys found this useful in figuring out if this is what's contributing to your symptoms. Of course, if you're dealing with any symptoms, feel free to reach out to us at knobpt.com or give us a call.